assessing the PSIS and the SI joint for any fixation, which is called a upslip hip. It may be on the right, left, it may be on the right. One side can be quite fixated. Those interlocking joints that we have in the sacroiliac joint, sometimes they can slip up a notch and get fixated there, and it can cause a lot of pain and irritation and inflammation through the sacroiliac joint, usually on one side or the other. So we assess that by finding our PSISs, and you can go straight to your dimples if your client has dimples. We go to the dimples, and the PSISs are usually just below that. Now, Hannah's dimples aren't all that prominent, so another way of finding the area is we come down to the L5S1 junction, which is where the spine starts to flatten out. So we've got this curvature here of the lumbar spine. When we start to get a bit of flattening out there, that's our L5S1 junction. And then if we just imagine where the sacrum sits, we can draw that triangle on, and then you're just going down about 1/3 of the way down the sacrum for where the PSISs sit. Now you do need to press in fairly firmly. On most people, they have a lot of connective tissue sitting over their sacral area in their gluteal region. Okay, so once I find those PSISs, I have a nice loose grip on those. My hands are around her hips, but the thumbs are nice and loose. And I'm going to get you to lean forward, so bending from the waist, that's it, and then down into the hip. And I keep the area moving. I'm wriggling like that, so I'm allowing it to move. Okay, and then stopping there. And then I assess where my thumbs are. And in this position here, there is no upslip hip, but what I would see is this, or this, depending on which side it was at. That's what I would see when she was bending forward, because that area is fixated. It's not allowing movement between the sacrum and the hip bones in that sacroiliac joint. So the area is quite fixated, and we end up finding that it slips up like that or like that. So that's what you'd see in an upslip hip. Okay, coming back up. We're going to imagine that we did have an upslip here, and I'll do the correction for that. So if you lie supine, please. I'll just do this side here. So this is a vigorous leg pull, which does not hurt, and it shouldn't hurt, and should only be done to people that don't have knee problems. If they've got a knee problem, you would just leave this out and treat the SI joint with DTF and work fascially around the area to try and get some change in there. So it's a vigorous leg pull which is going to help mobilise that SI joint which gets fixated. So I support under the knee and under the heel there, or at the base of the Achilles. And I just come up and down into this movement, flexion and extension of the hip, which gets our client ready for their part that they're going to participate in. Now the part that they're going to participate in is, I'm going to do that movement about 3 times, and on the third one, the client is going to help kick out with their leg. So you're imagining, Hannah, that you are putting the sole of your foot to the back wall there. Okay, so you're just doing a kick out as I do a distraction. It's like a traction-distraction type movement. So we'll just do that. So I'm just bringing the leg up and down, and as I bring it down, the emphasis is on the downward movement. So I'm putting a bit of traction on there, which you can see. So we're doing 1, 2, and 3, and we do that vigorous. So on the third one, I actually put in a bit more emphasis and put my body weight in. And she does the kick out, which assists with that movement. So we'll just do that again from the beginning. So 1, 2, and 3. Okay, so the knee's completely supported, and we're getting all the movement happening up at the SI joint. So we just hop back up, and we would recheck that if there's been any change. Now with Hannah there wasn't an upslip anyway, but always remember to check. So just bending forward. Okay, and that's miraculously changed. Come back down. Good. Okay. If it doesn't change, sometimes it may be very fixated where we don't actually get a change. In my experience, it is quite effective if you get the technique right. But having said that, if there's other things going on around the sacrum, like maybe a tight piriformis that could be compromising the position of the sacrum, it can go back to being fixated as easily as it was as it came back down. So if it doesn't change after that correction, you can go in and do your treatment around that area. So deep transverse frictions to the SI joint ligaments and fascial work, skin rolling and gluteal muscles as well as the lumbar spine there. So that's the upslip correction.
Okay.